We're now live, Mariah.
Great, thank you so much, Gary. I'm just going to share my screen, if that's all right with everyone, and put it in presentation mode. So, hi everyone, thank you very much for joining us today. My name is Mariah Cannon. I am a research officer at the Institute of Development Studies, and I have the privilege of chairing this webinar today. In this webinar, we are bringing together into conversation two projects at IDS, which I've worked on, which focus on children's participation and child rights. So using a framework developed by the Rejuvenate project, we reflect on the different types of children's participation in the Clarissa program and the choices made, as well as the factors which influenced how we engaged with children throughout different stages and moments in the program, moving from program activities which were child-centered to those that were also child-led. I'm really lucky to be joined today by three Clarissa team members. Kriti Bhattarai, who is Senior Program Manager at Voice of Children in Nepal and a participatory facilitator on the Clarissa program. Saima Saeed, Director of Operations at Monitoring and Research Gram Bangla Unayan Committee in Bangladesh, and also a participatory facilitator on the Clarissa program. And Mika Snyder, who is a research fellow here at IDS, who was part of the learning and evaluation team. So to kind of set the scene, about 2 years ago, the Rejuvenate team, quite an extensive team of awesome colleagues, set out to find out in what we hope and consider was a robust and scientific way, what evidence was available on the efficacy of participation in girl-led work. This work and the specific project, apart from responding to our own curiosity, had three primary objectives. These objectives were to show the value of participation. Although we recognize that this is an intrinsic right, we also know that it's needed in the current funding environment and in the political climate in which there's growing backlash. Also to show where the gaps are with regards to evidence, and to better articulate why these gaps might exist so that we can address them in future work. As we were undertaking this project, one of the challenges, amongst several, which I won't go into here, but you can read about in our working paper. So one of the challenges we encountered along the way was in determining how to define what is girl-led, as this term is often used fluidly across and within a wide range of programs, from those which delivered folic acid tablets to schoolgirls to those in which girls co-developed a girl festo. To help us make sense of this variable use of girl-led, we created a conceptual framework which separated types of participation into three categories along a spectrum. So these three types we broadly put into the categories of for girls, with girls, and by girls. We broadly define programs as for girls when girls were beneficiaries, but not necessarily actors. Sometimes these programs were tailored to the contextual needs of the girls that they benefited, but girls were not involved in the design of the programs. Programs which we categorized as with girls typically invited girls to participate in projects that were designed by adults. So girls' participation in these projects tended to be limited to predetermined roles. In the last category, what we call by girls, this is where we saw programs and projects with the highest level of girls' participation. So in these projects, girls have a central role in program and project design and also in implementation. These programs often had adults facilitating the emergence of claimed and organic spaces where girls made decisions regarding the issues that they wanted to address, the process for addressing them, and the actions they would take. Also, in some of these programs, girls decided on how they wanted to measure success. So looking across the breadth of programs and projects that we looked at and that fell into these different kind of categorizations of girls' participation, we noticed that kind of 4 themes emerged, or 4 benefits of girls' participation emerged in projects that had higher levels of participation. We recognize that it's not always feasible or even desirable given the context, time, and resources to have programs that are by girls. But what we found in the programs that were highly participatory was that they tended to share specific benefits. One of the first things that we noticed was that these programs tended to be more contextually aware and had more tailored programming. So these programs were more deeply embedded in the contextual reality of girls' lives. They also facilitated girls' agency while recognizing the structural constraints that girls experience in their own contexts and in the cultures where these programs were taking place. These programs also positioned girls as socio-political actors, but recognized the limitations of girls' participation, typically due to girls' existence within patriarchal and unequal power structures. The second category or kind of benefit that we noticed was that these programs had greater complexity and nuance in the metrics that they used. Evaluation sought to study project processes rather than simply measuring predetermined outcome metrics. Also, girls were often involved in determining the project aims and objectives, and thus orienting the project around the issues that mattered most to them. In the third kind of category, we have greater attention to intersectional marginalities. So projects with and by girls tended to be more explicit in their recognition of the multiple inequalities experienced by girls, those that go beyond gender and include race, education level, socioeconomic status, indigeneity, migrant status, disability, among many other identifiers. There was also greater awareness and response to the unequal power relationships between the adult researchers or facilitators and the girls participating, really highlighting some of the intergenerational dynamics that can take place when children participate. And the last category of benefits that we noted was greater accounting for negative externalities. So the only projects in our review which captured and examined negative consequences girls face as part of their participation in projects were those that were with and by girls. So, for example, many girls are incredibly time poor, and participation in projects can add additional strain with unclear benefits. So projects with greater levels of participation not only recognized these possible negative externalities, but actively mitigated against any harm. This also kind of calls into analysis and implementation around the ethical complexity and the importance of safeguarding, but safeguarding which still permits participation rather than precluding it. So given the benefits, but also the complexities and history of contestation around participation, and in particular children's participation, we thought that the end of the 5+ year Clarissa program provided a really key opportunity to reflect on what children, so not just girls, but children's participation looks like in practice and at scale. I'm sure many of you were attending this week's earlier webinars, and so already are familiar with Clarissa, but for those of you who are being introduced to Clarissa program for the first time, the Clarissa program was a research program on the worst forms of child labor, which aimed to identify evidence and promote effective multi-stakeholder action to tackle the drivers of the worst forms of child labor in selected supply and human chains in Bangladesh and Nepal. So this was primarily the leather sector in Bangladesh and the adult entertainment sector in Nepal. The program aimed to generate evidence in participatory, adaptive, and child-centered ways to improve understanding of the factors that drive the worst forms of child labor and how they are interrelated. So I'm just going to end my slideshow here. Give me 1 second. There we go. So looking across the Clarissa program, I now wanted to kind of invite Kriti, Saima, and Nika to think on the different types of children's participation that are, oh, yes, good. I'm still sharing my screen. You should see another mirror board. To think about the specific types of activity which they would consider for, with, or by children, and to reflect on why those choices were made regarding the type of children's participation. But when I asked them to do this, they reflected that it wasn't necessarily possible to categorize specific activities as for, with, or by children, but instead that we should really consider the different stages of activities and the types of participation that takes place at different stages. I think for me, this really underscores that theory and frameworks on paper can only take us so far, and we really need to look at practice or praxis and experience to take us the rest of the way. What they shared with me was that that all of the activities played an important role, especially those that were considered for children. And these played an important role in creating an environment in which activities by children could actually take place. So to help us think through and talk through some of these reflections, you'll see now on the screen that we've created a river of life, or in this case, I guess you could call it a river of children's participation, to look at the Clarissa program as it progressed through the different activities and the different types of children's participation. So if you look at the start of the river, which is at the top left-hand side, you'll see that at the start of the Clarissa program, we undertook quite a few activities that were child-centered, but not highly participatory. So at this point, I wanted to ask Saima, one of the examples you included or that you used was children's story collection as an activity that began as for children, but later transitioned to become more participatory. Do you think you could speak to that now?
Thank you, Mariah, for giving me the floor. And I really feel very proud and also feel happy that I was a part of Clarissa program, which was completely a project for the children, with the children, and by the children. And initially, we conducted the surveys or the neighborhood mapping to identify the sector and where the children are working. And as we started working during the COVID time, initially it was not possible to involve the children from the very beginning in the project as the researcher. That's why initially we, the adult, the program people collected the life stories. But during those life story collections, we had very good interaction with the children and we had very good friendship with them. And during that time, they started helping us to find the other working children so that we can collect the life stories from them. And after that, gradually and organically, we started finding out the potential future leaders who will lead the entire process later on. So that's how at first we started collecting the stories for the children, but at the same time, they started working with us and the project divert towards with the children.
Thank you, Saima. That's really helpful to kind of start to see how we transition from something that is for children to something that's with children. One of the next stages in the Clarissa program was to look at all of the stories that had been collected by the children. And as part of the analysis, we undertook quite large scale story analysis workshops. And I was wondering, Mika, if you wouldn't mind just kind of talking to us about what you think the significance of these story analysis workshops was and what role they played in this transition.
Yeah, thanks, Mariah. So as part of the Clarissa project, we undertook evaluation research alongside the whole process to specifically kind of identify what happens with children participation in this process. And what we found around the causal analysis collective workshops was kind of a key point where, as Saima was also mentioning, where the program moved from our work being for children and us collecting information from the children to the program really being with the children. So in that process of analysis, we worked with the children to firstly train them in the process of how do you do this kind of causal analysis of these stories. And the children themselves then undertook the analysis of the stories. And in the evaluation, we found that for the children to work together in these small groups and hearing stories from other children who were very similar to them in terms of their life experiences, in terms of the work that they did, hearing those experiences really helped them to see their own experiences differently and help them to see that what they have experienced in their own lives are very similar to experiences that other children have. And that helped them to feel less alone in their experience and feel more like a collective. And then, of course, also being able to discuss this together with others, and the program providing a platform for them to have those conversations, which is something that many reflected they haven't had before because of their busy lives, working and going to school and not having spaces where they can interact with their peers. Having the opportunity to work with each other on their issues and with the Clarissa facilitators really helped to shape a collective amongst the children. And they also felt like they were an active part in undertaking the analysis and that it was them who identified the issues based on the analysis that they did.
Thanks, Mika. I think you've articulated really well kind of what we've tried to represent with the river on the left-hand side, where we have the for, with, by, but we also have the individual, collective, and then the last stage of this kind of empowered or feeling that you have the ability to act. So Kriti, when did you in your facilitation practices notice a shift from working with children in a way in which you thought that, they were, collectivized, but then shifting to, feeling a collective sense of the issues and the problems that they were experienced, to them then also feeling like they could take action themselves and they could really work in a way and do things that were by children?
Yeah, thank you, Mariah, for this question and this opportunity. Actually, initially, this is very like we were also in dilemma, like how would they do and how would they can take actions, how do they design for themselves. This was also a learning for us later, because when Action Research Group started initially, we were the ones who supported making groups and all. And by then, after 3 or 4 months of rapport and trust building and being together with them, doing multiple meetings with them, they started opening up. They started opening up, sharing their issues. And then they started saying, okay, we'll be doing this. You have planned this, but still we think this would be more better for us because this is our situation. They started sharing all those things with us. And then when we moved, the group were moving ahead, there came a phase when we also realized that we need to let them decide what they want to do it. And we also started trusting them in the similar way that they trusted us. And some of the actions initially they took were they collected their peer members, they used to bring them, and then design some of the workshops and others. But later on, there came a phase when they said, I want to give you one example regarding one of the ARG groups in Gungabu, which was basically based on mental well-being of the children, because we could see lots of children struggling with their mental health who were working in these sectors. So they said that they want to organize a workshop with the business owners on mental health and cyber safety issues, And initially, and then some of the children said, no, let's split this in two. First of all, we'll organize a mental health workshop with the business owners only. And then later on, we'll organize this cyber safety and mental health issue with the school children, and especially community-based school children, because from there, most of the children come into the worst form of child labor. So we need to aware them. So that was children's thought, and they said that way. And we said, okay, let's do it that way. So this way, they did the one of the workshop with the business owners, and the second workshop was done with the school children. And after doing that workshop, they were not satisfied with that, and they wanted to take this more forward and said, now this time we will be facilitating. We will be giving those sessions to those school children. And they even selected which school to do the session. They they coordinated with the school management. They supported selecting the children, talking with the school management, and they just asked us to support in some of the contents. Otherwise, they were doing everything of themselves, and later on facilitating in the schools also regarding that. So that made us feel like, okay, now it's not just 4 children we are doing. Though we started with the 4, now they are with. And we are working with the children who can decide for themselves and who can select the issues and the actions to take to delve with that issues. So that's how our journey was, Mariah.
Thank you, Kriti. I think that was a really strong example to share. And something that you mentioned that I wanted to kind of bring back to you, but also to bring back to Saima and Mika and ask for reflection on, is you mentioned trust building, but I think you mentioned it in a way that's slightly different than we regularly talk about in these projects. So typically when we speak about trust building, we talk about gaining trust from the children that we're working with. And I think what you said, which I thought was really powerful, was about you needing to learn to trust the ability of the children. And I was wondering if whether you wanted to say something a little bit more on that, or if Saima and Mika, if either of you would like to come in and kind of comment on that point as well.
Yeah, just a bit on this. Because why I said this was because, you know, initially the group comprised of mostly those children who were really working and struggling with their lives and many issues around. So they were not even able to show up in all the meetings also, you know, like, and we were like, will they continue the meeting? We were we were also struggling. Maybe they could discontinue, or many things was going on. But in spite of that, though it started that way, later on they was engaged in such a way that they said, no, we will be doing this, and this needs to be done for these children, not for those children who are already like in a priority based or something like that. You know, we need to select some marginalized children, community schools. So such kind of decision making, when they started doing that, it was really surprising for us also. And we could say that, okay, it was trust. What trust really means, I personally also, I could learn from those incidents, you know, like otherwise, like you mentioned, trust, yeah, we trust children and all, we keep on saying like we trust children, we need to trust children, but actually acting with them, letting them do the things, that's how trust needs to be. So that what Clarissa has given to me personally as well.
Thank you, Kriti. That's really helpful. Saima, Mika, did either of you want to come in on that kind of the other side of trust building, you know, learning to trust children?
Yeah. Trust building is not a cup of tea, matter of cup of tea, and it needs time. Initially, when I started working, and when we thought that children will have to collect the story, then personally, I was very skeptical that whether they will be able to do it or not. I didn't trust them. And gradually, when we started working with them and we had the capacity building sessions with them, they performed very well there. And gradually, they started collecting the stories. Then I had the confidence on them. Yes, they can do it. Later, they also proved themselves very well during the analysis workshop. They were amazing. So then again, I had that confidence that yes, they can do it. And for they also had to trust us. And for that, we took so many initiatives. At first, we did the transact work. Then we invited the parents to our project office so that they can come, can sit with us, can have conversation with us. We made with their children and what kind of work they will do, so that they can the parents also can trust us. And we always keep in mind that what will be comfortable for the children and what will not be, because always they had the fear of their employers. So they wanted to do the work, but they always think that if they can do this work and the employers know that they are going to do something collectively, they may lose their job. So we always kept everything in the mind, and we also made them aware about the safeguarding issues. And also, we always ensure the consent. That is at first, we made them aware that for what reason we'll have to take the consent, and if they go for any survey, why they should take the consent. So every process was, we made them clear everything. That's why they also trusted us. That's why in the both way, we had the trust.
Fantastic. Thank you so much, Saima. Really comprehensive answer and excellent examples as well about different activities that were undertaken as part of the Clarissa program that built trust both ways. Mika, was there anything that specifically came out of the evaluation work that spoke to kind of the double-sided trust?
Yeah, I think building on what Kriti and Saima are saying, I think that trust of the adults towards the children is a really important issue to highlight, I think. I think broadly in the child participation fields, we talk about needing to build capacity of children to be able to do certain things. But what we found in Clarissa was that there's also a need for building that trust and capacity of the adults to work with children. And that was a really important factor to actually facilitate the move from working with the children for the program to be by the children, because once the facilitators were able to trust the children to do the work and they were confident that the children were able to do the things like collecting their own evidence and analyzing the evidence and taking their actions, and they saw the children do that, it also facilitates letting go of control over the group. And for facilitators to be able to hand over their control over the group to the children is that really important step from working for the children and with the children, for the children then to be able to take their action research group and really make it their own.
Thanks, Mika. That's a great summary that I don't think I would have managed on my own. So that's really helpful. Thank you. I think some of the things that are kind of bubbling up as well in this conversation are really important things that not only we needed to learn about implementing children's participation kind of effectively, but things that we perhaps needed to unlearn as a project team, but also as participatory facilitators of processes that we wanted to be more child-led. And I was hoping that maybe Saima or Kriti would like to share an example of something that specifically they've had to unlearn in this process to allow them to work more effectively with children.
What I learned that at first I'll have to learn that it's their life and they are the best person who know how to deal with their problem. If I think that I am the researcher, I am academic, I know everything, so I should impose what to do and what not to do and design the project accordingly, that won't work. And we'll have to know what the participants want about their life. When we had the dissemination workshop and we shared our findings, there were some development workers who were not very happy with our findings because they always think that child labor should be stopped. And we are not exactly talking about that thing in our through our project. That's why they were not happy. But yes, we also were working on this issue, that stopping the child labor. But I don't think this is the right time because this is not the reality. And we just focused on what the children wanted to do with their life. So we have to, as the development worker, unlearn that I know better what is good for them. That is the main thing.
Thank you, Saima. Kriti, did you want to add to what Saima has said?
Adding to what Saimapa said, we also had the similar kind of experience because initially we were thinking that this is a research work and children are doing the research. How can that be possible? How would they do? Maybe there will be something mistakes or something like that. You know, lots of things where they're not only personally me, but even our colleagues, we used to discuss how would be that. But after on, as we discussed, the phases when went ahead, we could learn that, oh my God, they are so perfect. You know, they were looking after the peers, because initially we were also struggling to search, because it was COVID time when we started story collections, and we were struggling to reach out to those actual children who were into the worst form of child labor and working into the adult entertainment sector. But once we could build a trust with them and collect the life stories, after that they started, they didn't struggle in the way we struggled, because they knew where the children were, because they were working together, so they can find them better, they can better collect the stories. So this how we could learn, like she said, Sam Appa said, like, we know better. It was completely de-learned. This thing was completely de-learned. And another thing was also the safe space. When we create a safe space to a children, after building the trust, then they come up their best, and they can decide for themselves what is right and what is wrong. For example, talking about child labor, yeah, we always saying like child labor should end. Working into adult entertainment sector is hazardous. Their children should not work. They are vulnerable. They are at risk. But not only once, many times when the workshops were organized, the children used to voice and say that this is not our demand, because if we stop working, then who will look after our family? Back home, my father is ill. My mother is ill. I have to take care of all the expenses, medicines and everything. My younger siblings, they are struggling for the education. When I work, they can get better education. So who will look after all these things? Until you look after all these things, you can't say stop child labor. You should make spaces free where we work, So that voices they started raising. So those things were really very strong, because we thought like, okay, ending child labor would end everything, like that would be very good solutions for them. But they were very different expressions. They said, no, we want the safe places to work, where we can at least work for some hours and look after our families also. So such things when came, that those all things were different learning for us. Yeah.
Thank you. And then perhaps this might be my last question for both of you, but I'm hoping that participants who are attending today will start to put their questions in. There's a question box, I think, function, which is very helpful. Thank you, Zoom. But I guess one of the things that I wanted to ask you is what allowed you, I guess, to make those pivots and the opportunity to kind of unlearn. And I know it was spoken about yesterday in the webinar for those who attended around adaptive management. But Kriti, you mentioned kind of pivoting and adapting to give space for children to do things that were by them rather than with them. And I wanted to know kind of what environment did you need as a participatory facilitator to make that possible?
Yeah, so at first it was the work experience with the children, because we were also learning together with the children. After this project started, we were learning together with the children. So the opportunity to learn together, this was one of the spaces where we could say, okay, we are not making them learn, or we are not like saying them to do this or that. We also need to learn many things from them. So the moment we had this realization, we had this not exactly the realization, so like the real experience after working into the field. So that was one of the major turn back, I think, to give that space. And when and also we were also equally, I think, capacitated by IDS and all the teams in how children will be involved into the what participatory research is, how children's participation is important, and all those things where we were also capacitated. So that was also the environment. And another, like, adaptive management, this was very crucial for the whole project, because as we have been continuously saying that we started with the COVID phase. So since then, our adaptation started, like what would work with children, supporting them during the COVID time, being in touch with them in their crucial times. How would they feel? Is there anything that where they need any support, like psychosocial counseling, and all those things were also being provided, and these things also connected us with them. It was not only children being connected to us, but we were able to be connected with them. So I think this connectedness supported us to create that environment, that safe space where we both were trusting each other, and we were not unknown to or susceptible, skeptical to any of us. We were completely together, and we just let once we had that confidence, like, okay, we saw that evidence is children deciding for themselves, then things just went on, and the result is there.
Great. Thank you, Kriti, very much. Saima, was there something that made essentially you undertaking participatory research with children kind of easier or more possible? We often talk about the enabling environment for children to participate, but sometimes we don't necessarily consider what participatory facilitators need in their environment in order to work with children. And I was wondering if perhaps you could share a bit from your perspective what that was like.
At first, we'll have to trust them, and then we'll have to respect their opinion. And we'll have to think that as a facilitator, what I used to do, I used to ask them lots of questions, deepening questions, and try to understand what, if they come with an idea, I always used to use the magical words like good, excellent, and I always try to motivate them to open up their mind, to open up, to be open up. That's how, that was one of the way to make a novel environment. And another thing was, in this project, we were allowed to make mistake. Nothing was fixed that we'll have to reach that goal. And we always had the reflection sessions. Like in Hazaribagh, at first the children, when they developed the theory of change, at first the children thought then that when they will start using the occupational safety equipment while working, they will have the health benefits, they will enjoy the health benefits, they will get less sick. And because of that, their productivity will be increased, and after that, their income will be increased. But after sometimes they find that it is not possible to see the change in income within a very short time. Then they thought about their capacity building. That's why then they sat with the employers and they set up the training center, and they made the changes in their theory of change. So when we give them freedom that, yes, whatever decision you can make and you can run your project according to your decision, then the participation can be ensured.
Thank you, Saima. Thank you very much. Thank you, Saima and Kriti, both excellent examples. And then just Tamika, I think before we open up to, I'm seeing some questions flood in, so thank you, everyone. Just whether or not anything came specifically out of the evaluation around an enabling environment for participatory facilitators to do work that was with and by children.
I think what Saima and Kriti have summarized was very good in terms of having a a program level approach to participatory adaptive management, where there was freedom to make mistake and have a very embedded reflecting and learning infrastructure, where we had regular after action reviews on an activity level, but also on a country level, where we came back together for every 6 months to reflect on how things are going and adapting based on that. Yeah, from the evaluation and what was discussed in yesterday's webinar as well, that really helped to do the participatory action research with the children on the ground. So almost having participatory action research on a program level replicated on a ground level really support that process.
Thanks, Mika. So at this point, I've asked the questions I have right now. I'm sure I'm always going to have more for Kriti and Saima and Mika. And just to kind of wrap up before I stop sharing my screen, I think that what was shared today, or at least what I'm going to take away, was really around this idea of kind of bi-directional exchanges between participatory facilitators and children, in which capacity building, there's capacity building of the children so that they feel that they are in a position to take action, but also capacity building on the part of the adults so that they are better able to support children's actions. And the same with trust building. So, building trust with the children, but then also having to learn how to trust children as well. And how all the different types of activities and the different levels of participation kind of supported one another throughout the program. And it wasn't necessarily a case of putting things in kind of boxes of by, with, for, but rather looking across activities and seeing how different types of activities and different levels of participation ultimately supported and enabled the kind of higher levels of participation. So once again, a massive thank you to Saima, Kriti, and Mika for sharing their experiences. And then at this point, I just wanted to open to our audience to see if they have questions for our incredible panel, and maybe also some reflections. So I know I have Eve here from the IDS team. Thank you very much, Eve. I'm going to also open the questions and see if I can answer some of them. I can start with the first one, if that's all right. This is from Sukanta. Sukanta, also part of the Clarissa team. So hi, Sukanta, thank you for joining us today. And Sukanta says, would like to know if the project got engaged with girls only. If so, then would like to hear your thoughts. So I can answer this one. This is regarding the Rejuvenate project that I presented on. Yes, we only looked, and I should say, in terms of design, it was a kind of evidence and literature review. So we weren't working directly with girls in that program. Instead, we were reviewing different program resources, gray and like readily available public literature on programs that self-defined as girl-led. So that was a specific choice that we made because we particularly wanted to look at things that were girl-led, recognizing that there are lots of complications with that as well. And happy to talk more about that, but I do think the working paper, fingers crossed, does explain that choice a bit more clearly. So thank you, Sukanta. I'm gonna, oh, sorry, I'm just playing with the settings on Zoom. I have a question from Mary Wickenden, who is a research fellow here at IDS, who says, hi there, very interesting. Were there any areas of the project and activities that the children didn't want to get involved in or found difficult? So I think that's an excellent question. Put it to Saima and Kriti.
For Nepal part, I think because children were deciding their actions because they were wanting to do it, and uh, instead of saying that there were any actions that children didn't want to do, actually, as I mentioned the example earlier about doing the mental health and cyber safety seminar or workshop with the community school children, we adults were like a skeptic. We thought like they would not be able to do that on their own. How would we let them do on their own? Will that be easier for them to do? It would be too difficult task, because we also that was almost at the end of our program, so we were not sure if they would execute the program, or we were also somehow like maybe they will be disappointed if it won't go well, that thought was within us in the adults. But they were so confident that they wanted to do it at least in one school, and they successfully did that did that program. They were the facilitators, and they did the sole group organized that program, coordinating with everything, and there were around 40 to 50 school participants from grade 5 to 10. So that was our learning also. So for Nepal, I think they discussed in the group, and children decided their actions on their own. So maybe because of that also, there were not such actions which they should say like, okay, we will be not doing this or something like that. We couldn't see such examples. Instead, we were skeptic, but they proved us wrong.
Thanks, Kriti.
Um,
Saima, yeah.
yeah. In this process, no action or no theme was selected by us. Every action and theme were selected by the children. So, while choosing the themes and the actions, they had lots of debates among themselves, and they discussed what will be possible and what will not be possible. During the design phase, they did everything. That's why there was nothing that they don't want to do anything. But in some cases, they had some strategies to face the situation. Like in Himayatpur, the situation was very difficult. Always the children had the fear of losing their job. That's why they never wanted to face the employers directly. And they also had the fear that if the employers come to know that they are unitedly doing something together, maybe they will misunderstand them and they will take any strong actions against them. That's why what they did, they went on they started very soft strategies. Like at first, they started using the occupational safety equipments by themselves and tried to make them the example within the community, that look at us, we are using these occupational safety equipment, and that's why we are now protected from the accidents and the injuries. So after that, by seeing them, the other workers, they showed their interest that we also want to have these occupational safety equipment. And then they did their action. They provided the occupational safety equipment through the help of the project to them. That's how they worked. That's how they took so many small strategies to face the employers and the harsh environment. But they were never skeptical about any action. Thank you.
Can I add another example, Mariah? I think
Yeah, absolutely. Thank you.
I'm thinking about one of the groups in Nepal that was going to work on the issue of alcohol use in the family and how that linked to children ending up in child labor. Because in the beginning, that group was not that excited about working on the issue of alcohol use, because they saw it as something that was very normal in their communities, something that happens everywhere, maybe not something that they could address as children. And I think this is quite an interesting thing to highlight here, that even though the issues of the action research groups were selected by children through the causal analysis of the stories that were happened. The children in the groups were not necessarily the same children who selected the issue. So for some of the groups, there was a bit of a process at the beginning for the children to learn about the issue and why this was something that was picked by children to begin with. And so for those groups, they went through a process of looking again at some of the life stories that were shared by some of their peers and the causal analysis that was done on the stories. And the children also went out to do their own interviews with other peers in their community and with parents in their community. And through that process of kind of looking at these different pieces of evidence, they learned how alcohol affected lots of their peers, how it affects the adults in their community, and also reflected on their own experiences with their parents' alcohol use amongst each other. And through a couple of months of going through that process, they then became convinced that this was an important issue to work on as a group, and then wanted to go into that issue as thing, and ended up developing some good actions around this as well.
Thanks, Mika. I'm going to start. I realize I should go chronologically with the questions. So apologies for those who were at the start and then didn't get their question answered. I've got a question here, and I'm not quite sure we can answer it, but I am going to pose it. It's two questions from Mahmudun, who says, first, can you please highlight some points about the sustainability of this project? And two, were there any alternative livelihoods for the parents? And was there an intervention with the employers? So I'm not quite sure how we want to take those questions. I know number 3, was there an intervention with the employers, is an easy one to answer, and perhaps not one we can go into in depth in this webinar. But yes, and both Saima and Kriti were participatory, or sorry, Saima, I know for a fact that you were participatory facilitator with employers as well. So I didn't know if you wanted to speak briefly about that, but leave it open to you.
I have some connection issue. Please, can you repeat the question?
Yes, sorry. So we have 3 questions. One is, can you please highlight some points about the sustainability of these projects? 2, were there any alternative livelihoods for the parents? And 3, was there an intervention with the employers?
Okay. At first, we had a long process of how to end up this project, and we had long discussion on that. And we always thought about the sustainability of this project. That's why what we did, in some cases, we had in Hazaribagh, the children and the employers, they took the responsibility of the initiative of a training center, of a vocational training center. And there, the employers, they play the role of the trainers, and the children, they also collect the new students. And when they are confident, then they will also be able to be the next trainer. They will play the role of that. That was the modality in Hazaribagh. In Himayatpur, we searched for some other donor agencies, because their initiative was to set up a primary healthcare center, and that needs some funding for that. So we communicated with some other donor agencies, and Protiji Foundation, they were positive about that, and they gave the funding. And still that a primary health care center is going on, and and in Bhairab, the children and the employers, they have very good relationship, and they also build relationship with the school management committee. Some of the employers are also the members of the school management committee, and they made some decisions in favor of the working children. That's why their initiative of enabling the environment for the working children in the school, that initiative is also going on there. So their work is still going on. So that was the issue of sustainability. The other question was about
whether we
the
work with
alternative employers. I'm sorry,
Yes.
can you
Sorry,
repeat
so
it?
yes, I think you did partly answer it already, actually, in your explanation. But
Yeah.
one of the questions was there an intervention with the employers?
Yes, we with Gram Bangla, we had we worked on total 6 groups, and 3 groups were with the children and 3 groups were with the employers. And the employers also took the initiatives for the betterment of the children. Although initially they were more interested about their own interest, but gradually they went to a win-win approach, by which they also became benefited and the children also became benefited. And the last question were there any alternative livelihood for the parents? No, we did not have any kind of initiative on that.
Great, thanks you, Kriti. Sorry, Saima. Thank you very much. Kriti, perhaps you might want to also talk to this question, but also I'll bring in Lucy's question at the same time because I think it's relative. Lucy asks about ending the process. How did you and the children feel about the end of the project? What legacy do you think Clarissa's child participation work will leave on the communities you've worked in? It is often such a hard time for projects delivered with children.
Thank you for the questions once again. So definitely the end part is always hard for all of us in no matter whatever work we are doing. But the good thing about Clarissa, I think, was that we all knew that when the program is going to end and how this will be, because we always discussed and designed like how, and we not only discussed this within the manager level or like within the Clarissa team, but also with the children's and business owners with whom we were working. We clearly had informed that the groups will be running for these months, and there you can plan the actions. And for certain months, even after the program, we can like support them with the like maybe psychosocial support or something like that. Even after the program, there will be that sort of support to them. So that's how only the meetings were being ended. And also the other part that will also cover the next question, I think, about like sustainability. Like we had 2-3 strategies for this. For example, we worked with the local partners also, local partners also, who were working with these children. And we collaborated with them initially from the initial phase, because we already knew that even after we leave, these children will be with those organizations and they can support them and further take on these activities, whether it be children or business owners. Here I want to also say that we had 3 business owners group, and all 3 business groups are still running. Like for Dance and Dori Bar, they have their own association, and through their associations, they are working on with they are taking on the Clarissa's initiative, like working on child labor, trying to make their spaces free of child labor, or at least risk-free zone. Such kind of activities are carried out by those business owners. Even massage and parlor spa parlor business owners, they have formed their association, and they have also already drafted these 14 points code of conduct, which strictly prohibits the child labor within their sector, and all other code of conducts are also there. They are doing that. And Khazagar business owners, they are also, every month they meet. The same ARG group we used to run, they meet in the organization where we mutually work during the Clarissa, and they take decisions, they have their self-help groups and all those things. It's going on still now. So that's, I think, good part, and that can say we how we work. And also we had created one champions group and collaborated. That champion groups was consisted of those children who wanted to be with us even after the Clarissa. So we collaborated with them, and we connected with them to Voice of Children's another program, cyber safety program, and now they are there, and some of them are peer educators also. So in that way, I think we had planned, and we are going on.
Thank you both so much for those answers. I've got kind of a follow-up answer or question, from Tessa, related to employers. Tessa asks, do you think your work changed the employer's view of the children that you were working with?
Yes, certainly. Because initially, when we started working, we used to hide the word child labor from the employers, because in Bangladesh, employing children in the worst form of child labor, like in leather industry, is banned. You cannot employ them. But as this is the informal sector, the employers hire them, and always they want to hide this. That's why strategically we not explicitly talk. We used to not talk explicitly on this child labor issue in front of the employers. But gradually, when they started trusting us that we are not harmful for them, and they also expressed their demand for skilled labor, and also the children also expressed their interest to have to build their capacity in sewing or other things, so that their income can be increased. And collectively they set up the training center, and unitedly they started working. And also in Bhoirav, the employers, they also helped the children. So, and from the very beginning, it was very difficult for me to work with the employers, because first of all, they're very pessimistic. And although the children are very optimistic about the change, employers were not. And they always used to think about only their own profit. They did not think about the others. But gradually, when they understood that if they set up any training center in their locality, and they train the children, they will also get the benefit. Both of them will be beneficial. From only their own benefit, they started thinking about the workers' benefit also. So this kind of shift happened in this project.
Oops, I was muted. Sorry about that. Thank you, Saima. I have a couple, there's a few more really good questions in the question answer facility on Zoom. I don't know, it's not the chat, so I don't know what to call it. But I've got kind of a trickier one, I think, for us, and maybe one we could think about collectively. But it says, great initiative. I was just wondering, how do you see the impact, especially in terms of shifting control through the buy approach, considering the broader development process, such as decision-making processes, has always been centered in certain groups of people? How do we make sure this kind of participatory research can actually navigate this unequal power relationship? I think this is a really hard one to answer, so I appreciate it but put here, but Mika, I see you leaning forward. Did you want to come in on this one?
I think it's a really interesting question, and I think it's a question that really cuts to the core of the whole issue. When we talk about participation, it's all about power relationships, of course. Some initial reflections that come to my mind is specifically when we talk about child participation is the dynamic between children and adults. And something that we saw a lot in the groups of children is kind of a shift that happened as well in the children, where initially that context of them being children, being challenging and being unsure about how adults would perceive them when they would start taking actions. And even once some of the groups started taking actions, for example, one of the groups on tackling child marriage started talking with adults in their community around the issue of child marriage and found that they were not being taken serious by the adults that they were talking to, which made it really hard for them to be motivated to continue and not sure what to do with that. And in those cases, the collaboration between the children and the adult facilitators then became really important to address that power dynamic. As a first reflection. The other thing that I found really interesting to reflect on with this is what happens when children start taking actions, especially in the context of the businesses. So one of the groups that Saima already referred to, the Hamaidpur group that worked on workplace safety, where they were not provided with safety gear from their employers, and they would not want to ask for it because of that power relationship of the employers or the employees being scared of losing their jobs, but instead taking their own decision to start wearing protective gears and taking their own power basically to take the action that they needed to improve their life, and being encouraged by facilitators and supported by their peers to do that. I think it's an interesting example of a shift in power relationship when a group of individual children become a collective, and as the collective become a more powerful unit in this whole dynamic. So by starting to take actions as a group, they can shift some of those power relations. Those are my initial two reflections. Curious to hear your reflections as well.
Yeah, I just want to give some one example only, like when initially in all the groups, like there were separate children group and separate business owners group. But while neighborhood mapping, we brought them together, business owner and children both were also working together doing the researches, and that time also this power this dynamics was clearly shown during the workshop discussions and all those, because when initially children were not like, they thought like business owners are the ones who trouble them, among others, like they don't understand their feelings or something like that, and that thing they already they had it. and they were not willing to talk with the business owners. But when during the neighborhood mapping and workshops, children and business owners both were together and they were discussing about the issues. Business owners was discussing from their point of view and children were discussing from their point of view. One example I could still remember, like there were discussions regarding wearing the shorts dresses by the children who were working in the khazagars or massage spa and dori dance bar, especially Khazagar ones, when the business owner was saying that like they wear very short dresses and then that is appealing and that might put them into the risk, vulnerable conditions. But children opposed, and there were 2-3 children like coming together and saying, no, we wear those dresses because it feels easier for us to work, because we need to do lots of work in the Khazagar, and wearing very sophisticated kind of dresses, it becomes difficult for us to work. So if we wear comfortable dresses, then that's easy. That's not what you think and present this way. So they were opposing what business owners were saying, you know. So this way, like when they come together, also many things come up, and maybe the solutions or the actions taken by them would come up in this way also. We had this we had witnessed these things also.
Thank you, Kriti. Thank you, Mika. There's a great question also in the chat from Marina, who asks, and I think you've kind of touched on some of this already, but Marina asks, what stages or moments of the action research group process did you find most challenging to facilitate, and why? And was it different depending on the group you were working with?
I already have mentioned about the employers group. That was the most trickiest part for me, the initial phase, because we had the relation with the children, it built organically with us, because we had a long series of works with them. That's why we had very good relationship, already good trusted relationship with them. But the working with the employers, the process was not like the children's. We collected the data through 35 interviews from the employers, and then we selected the themes, and after that we went to the field to form the groups. So it was somehow imposed thing in the entire process. And I already have mentioned that children are very optimistic, although they also face so many difficulties in their life. But the employers, they were very, very pessimistic about everything. They never believed that any kind of a positive change can be brought. That's why initially I felt very disappointed that what will happen? Will they be able to form the group? Will they work together? Will they have any action? I had that kind of questions in my mind. But gradually, when we started sitting together, started having debates and what can be done, what cannot be done. Then I felt okay, that it's good that they are having fight. That means they are taking the group seriously. It's not a process of passing time. They're taking this seriously. And then gradually the group formed and started taking some actions. So for the initial stage, to form the group of business owners, that was most challenging for me. Thank you.
Yeah, for Nepal, if we say like definitely that was different experience from business owners to children. Even within the children group, also we had different experiences. For some cases, the tough part was the initial phase, the rapport and trust building. But for some groups, initial was very good. We could very easily catch up with the children, like build trust, rapport. Everything went on very smooth. But when the action phases came, like they were not so much interested, or some like they need some push factors, like so it depended as per the groups also. And for business owners also, yeah, initially business that was more tricky and tough, as Saima mentioned, because they thought like most of the development programs, especially NGOs, they come and show their negative parts and all those things. Those things were there within the business owners, so they didn't want to talk to us, or they didn't want to give the exact informations, what they had, or what they have gone through. They were not able, ready to share the experiences in the initial phases. So that was tough, and to build that trust and make them trust and make them feel that we are not there to harm them. So that was very important. Once we could establish that, then only it was easier for us to work with the business owners. Whereas in children group cases, some we found difficult in the initial phases, but in some cases there were also when children were lagging back, like they were not showing so much interest, and things were happening in that way also, where facilitators, as a facilitators, we had to work hard and bring them back into the momentum.
Thank you, Kriti. Thank you, Saima. I have, perhaps I think we might have just time for one more question. And I think this is a really good one for this webinar's topic around participation with children. And it's specifically around safeguarding. So the question is, what safeguarding measures were used during the research process? And I think this is an excellent question to address now, because I think the Clarissa program had a really kind of adaptive approach to safeguarding that allowed for children's participation, but also mitigated against some of the risks. So I just wanted to, invite both of you now to maybe give a couple of examples of our safeguarding process.
In Clarissa project, we had one appointed person for ensuring the safeguarding. And before doing any activity, we used to do the risk assessment. And according to the risk assessment plan, we used to take the safeguarding initiatives to mitigate the problems. And the other thing, we always used to have the consent form before doing any initiative. We used to use that. And I already have mentioned that before forming the group of the children, we invited the parents to our office, so that they can see where the children will work and with whom they will work, on what they will work. And as I already mentioned, that we started working during the lockdown situation to ensure the COVID protocol. We used to have one studio, interview studio, where we maintained all the protocols, and also had the glass wall, not have the interaction with them. So this kind of small initiatives and some other initiatives we also took to ensure the safeguarding of the children. Thank you.
Yeah, and for Nepal also, as Saimali mentioned, the risk identification and mitigation plan we had in place for each activities, not for the whole, not only for the whole program, but as per the activities, we had this risk identification and mitigation plan, and safeguarding focal person was leading all the safeguarding issues. And also we had the mechanism of reporting within 24 hours if we see any children in vulnerable or risk condition or psychosocial support needing condition, we could report that within 24 hours. Those reporting mechanism was also there. And as I mentioned earlier, safe space, we from the initial phase only we started looking after the safe spaces, and we discussed with the children that safe spaces was not decided by us. We also discussed with the children like what actually safe space means to them, and that's why we organized meetings and the research processes to the place where they feel comfortable and they feel safe. So we arranged such places so that they could participate in a better way. And also another important part, I think, was the building capacity of the staff members also around the safeguarding concepts and protocols and everything, because we were trained from the initial phase, like what safeguarding means, how we can take care of the children if there are any breakdowns or breaking downs of children, or even we as a researcher, we were overwhelmed sometimes. So what would we do in such cases? Such things were trained to us also. So it was not just only children. We adult were also supported in that way. And to give one example, and also in Nepal cases, like whenever we conducted research like neighborhood mapping or journey mapping or something like that, we also coordinated with the local security officers. We used to hand over the letter and say like, this place or within this time to this place, there will be these children who will be doing the research. So if any support required, we would like to inform you that if in previous earlier that we might require any support. In that case, we need your support. So we used to give that letter also before conducting such research. So that was also one of the part. And psychosocial counselor was also there. So if any such cases, then we would refer, and then she would support those children needing psychosocial counseling. So that was also one part. And also while developing, as I already said, while developing mobile apps and all that, also we discussed with the children that what safe guarding or what safety means to them. So according to them, we planned our actions. So those were the major methods or major actions we did around safeguarding.
Thank you. We have one last question in the question chat box thing. I still haven't figured out a good name for it. So yeah, I think this is an interesting question about trust, and maybe not particularly one that we can answer in terms of participatory facilitators. But the question is, how does working with the children department, and I assume this is kind of the national level children's department, and the police help to build trust, or to build back trust? Because sometimes when children are doing things against the law, they are normally harassed by the police. So how do we rebuild the trust back? I'm not sure this is one that we can answer, but just wanted to open it to Kriti and Saima if you had reflections on this, because I know particularly in Nepal, there were some, complications with people in, these positions of power, particularly police who used to harass children who were working on the street, or who used to, come to the venues where children were working.
So in this regard, Mariah, and Nepal had that experience also, and during the story analysis also, many children came up with that issue that they were either working in the children or living at the street or working at the street. They used to encounter with such problems. The higher officers or police, they harass them, like when they are street vendors, that they are like they're cut by police, and when they are living in the streets they have other many problems. So they had this issue, and after as an action also, one of the group, I think it was Gungabu, who took this action and who tried to bring these police personnel also together, you know, in one of the workshop where they shared what they go through. And then like they had an open discussion, interaction program with these police officers, local authorities, and along with the business owners and other people, stakeholders. They arranged that interaction programs, and they shared their issues, where it was found that in many cases the police officers are also not so aware of what sort of problems children go through when they are in the streets. So they had accepted that they are also just following the law without knowing the consequences or the causal relations of children being there into the streets. So they have shown their commitment to take this in consideration while doing further their actions and all those things. So maybe that was one I can share with you regarding the, but yeah, there's conflicts and many children share those conflicting situations.
Thank you so much. I'm really sorry we're gonna have to end now. I just wanted to say a massive thank you to everyone who attended today. A particular thank you to our panelists, Kriti, Saima, and Mika. And just to say that Clarissa and Rejuvenate have produced many resources that are available to anyone who's interested. And also, in particular, what might be of interest are the learning notes in which we reflect on some of the processes that we have undertaken. These are all available on the Clarissa website, which for those who attended, we'll send out a follow-up email that'll have a link to this recording and also a link to the website. And then also to say we've got an excellent resource called People-Driven Solutions, an introduction to facilitating deep participation for systemic change through systemic action research programming. And there's a particular section that's about working in a child and people-centered way. So I really recommend looking at that. And I think Marina has kindly put that in the chat. So just to say a massive thank you to everyone today, and to kind of, I guess, ask people to keep these discussions live and hopefully to engage in any future events that we might have. So thank you so much, everyone. That's the end for us now.
Thank you. Bye-bye. Thank you so much. Thank you.